Before the invasion by Russia, Ukraine had only managed to vaccinate 35% of its population. Fleeing the threat of war, refugees left particularly vulnerable now face another threat, the threat of heightened transmission of COVID-19. Here now is a report.
Hospitals in Ukraine are overwhelmed. The staff has been stretched thin. Amid threats of constant shelling and bombardments, keeping tabs on COVID-19 was forcibly put on the back burner. But the threat of the virus still looms large. 65% of Ukrainians remain unvaccinated. Hundreds of thousands are forced to flee from constant shelling by Russian forces. Women, children and elderly are fleeing across the borders and are forced to huddle in tiny spaces and interacting with various people. May just prove to be a recipe for a new mutant variant of COVID-19.
Different variant and the different mutation can be forced by the mixture between the people who had infected by one specific mutant. If you have 3 or 4 or 5 of them at one place, new mutant can appear as a more stronger and can cause more stronger disease.
Research by the WHO from over a decade and a half ago shows that a majority of the infectious disease outbreaks occurring in the 1990s were among refugee populations or in conflict zones. Things don't look too different this time around either.
It's a different situation, completely different pandemic than what it was 1 year and 2 years ago, when it was important to establish the lines of infection and try to limit the infection that way. With Omicron, it doesn't work. And also the situation with close to 2 million people leaving the country are so extreme. So putting a lot of effort in trying to trace such an infection as a respiratory infection, the COVID infection would take enormous resources. And I think that the resources are needed elsewhere for these people right now.
Despite the bloodshed and chaos, hospitals are trying to keep a tab on the spread of the virus. As of March 8th, there were 731 COVID-19 deaths recorded in Ukraine in the week prior. Not just COVID-19, supply of other life-saving treatments like that of HIV, hypertension, diabetes have been severely impacted as well. As per the WHO, since the start of the invasion, there have been 16 confirmed reports of the attacks on healthcare systems. Even during these unimaginably volatile times, hospitals, healthcare staff and volunteers remain undeterred. Bureau Report WION, World is One.
WION is now available in your country. Download the app now and get all the news on the move.